No one disagrees that healthcare is broken. No one disagrees that it needs to be fixed. The problem is most of the solutions that we were seeing were solutions that weren't going to make anything better in the long run, and most importantly, weren't going to help improve patient care. As a primary care physician myself, and I've been in practice for 13 years in the Oklahoma City area, I felt a significant level of dissatisfaction on many days with my ability to spend time and truly affect change in their overall healthcare status. You just can't see 40 people in a day and in my opinion, do great medical care.
About 60% of my time is spent with paperwork. It has slowly and slowly taken me away from patient care to where I do more paperwork away from the patient.
We're all operating within a current paradigm that was established years ago when health insurance became so tightly wound into the fabric of the delivery of health care.
Some insurances are very slow to pay, and so it's multiple statements, lots of activity from our accounts receivable team, and there's cost involved in doing that.
The average primary care visit is anywhere between $90 and $120. The cost of filing that claim from a provider, a primary care physician's, the cost of processing that claim from an insurance perspective almost exceeds what it costs to provide that care.
The solution has to be a paradigm shift. Let's get back to where insurance doesn't have to pay for everything. The analogy I would use is if you need to get an oil change for your car. None of us think about asking our car insurance company to help us pay for that oil change. We just get it done.
There's no reason for somebody to be involved in coding, billing, and collecting for a blood test in a doctor's office. That $50 cost needs to stay a $50 cost.
By taking a direct medical approach where you take insurance out of the equation, you're able to save 50% on the cost of running a medical practice immediately.
SalernoHealth is a direct medical care program. It's a network of experienced physicians and facilities and services that we put together and created with a monthly membership option. If you think about roughly between 42 and 48 cents on every dollar you spend in healthcare goes towards billing, coding, collecting. So if we can remove that, the cost savings that we generate, we pass on in our lower membership fees.
The goal of SalernoHealth is to give equal opportunity to individuals that do not have health insurance. Today the cost is so extravagantly high, and we have a way of now offering this program to individuals, the self-insured as well as people that are non-insured, and at the same time give great quality medicine.
What we think is better care, because now you can spend more time, and where that physician is not rushed to see 50 patients a day, they're compensated as such that they can spend 15 to 20 minutes or an hour for the patients they have to.
SalernoHealth allows me to be with my patients more and allows me to spend less time with paperwork.
Well, SalernoHealth was never meant to replace health insurance. We fully encourage people to have a major medical plan. It's critical that they do.
We're not looking to fix hospitalization and how do you pay for expensive cancer therapies. We're looking to partner up with people who are working on those solutions.
Our basic premise is that utilizing SalernoHealth as your primary and especially surgical needs, coupled with a major medical plan that's designed around what we don't provide.
All of our physicians have mature practices. They're established in their particular field. It was important for us to identify these physicians that we had had experience with or had a reputation in the community. We feel our network of physicians is second to none.
And on the specialty side, we sought out physicians that are at a level of competence that people will seek them out. All very well-known, respected physicians in their fields.
We jumped at the opportunity to be part of SalernoHealth. SalernoHealth has a great mission statement to provide great care to patients, and back in 1998 we started with the same mission.
So what happens when you get sick? If you're a SalernoHealth member, you call our Medline. And if it's during business hours, a nurse is going to answer, and she's going to answer your questions. If you need an appointment, that nurse will get you an appointment with the provider that's closest to you. And if it is something that's acute and you need to be seen, you'll be seen either that day or the next day by one of our providers to get your healthcare needs met.
Several months ago, I had a severe headache. And I'm one of those people, even with health insurance, I don't go to the doctor over everything. So I kind of stuck it out, and a few days later, my headache started getting worse. And I woke up in the middle of the night and I told my husband, I think there's something wrong. So we went to the emergency room. I had a CAT scan done. They didn't see anything, so I had to have an MRI. And $8,000 later, I had a sinus infection. What that would have cost me with Salerno would have been my primary care visit, $30, and he would have sent me to get an MRI if he felt like I needed it. So it would have been about $80 versus $8,000.
This model was designed for employers because for primary care and specialty care, it's simple for them. It makes their costs predictable. So if I have 500 employees times X amount that we charge on a flat fee, that's their cost.
Healthcare costs used to be number 15 or 16 on the budget. Well, now in the last few years, it's got to be number 1 or number 2 or number 3.
Unfortunately, in today's market, there's a lot of people who don't go to the doctor because they don't have insurance or they don't have access.
The Affordable Care Act actually has included in it, in the legislation, a part for direct medical care. The best part of that is that as the mandate or the tax, that was a big decision employers needed to make, is do I pay the tax or do I provide the coverage? We've answered that for them. You can provide the coverage.
When we signed up with Salerno, I immediately said, oh, I can go see a doctor now. I can afford this.
Our motto is delivering healthcare the way it should be. We feel that physicians and patients need to get back together again.
This plan is ultimately reproducible. There are physicians in every city. There's a network that we can couple together in every city. There are small companies in every city. There are people that are seeking health care in every city.
I do think that groups like SalernoHealth are going to be the future of medicine. It's a cost-effective way to practice medicine.
The ability for businesses to save money, for physicians to be able to find a marketplace that works, then I think the community wins, everybody wins, because we have a healthier population.